have to wear my glasses.
Ladies and gentlemen, welcome to All India Radio Houston. I am Dr. Nick Nickham, your host, and we will be here for the next hour. This is a talk show where we focus in depth on one or two topics that are of interest to you. If you would like to be a guest on this program, please contact us at 281-265-7567. This program in part has been sponsored by Sugarland Heart Center. We'll be right back after these messages from our sponsors. Good morning, ladies and gentlemen. Welcome to All India Radio Houston. I am Dr. Nick Nickham, your host, and we will be here till 11 a.m. You are listening to 1050 KCHN Houston Radio, and we have two special topics today. First, during the first half of the hour, we are going to be talking about arthritis, joint pains. Do you have joint pains? And this is the topic you want to listen. And if you'd like to join in the conversation, the number to call here is 281-745-4161. And during second half of the hour, we are going to be talking about Delhi elections, or Delhi elections, whatever you want to call it. We have two special guests from Houston, and they are going to give us an update about the recent Delhi elections. Well, today is Valentine's Day, and my special guest for arthritis is Dr. Saba Khan. Dr. Saba Khan, welcome to All India Radio Houston, and we are delighted to have you. Happy Valentine's Day to you.
Same to you.
Okay, Dr. Saba Khan, so you're going to be talking about arthritis, and before we go, tell us a little bit about your background, where you come from and where was your training and all this.
Sure. Well, first of all, it's a pleasure to be here at Radio 1050 AM with Dr. Nickham and my audience. My name is Saba Khan. I'm a rheumatologist by profession. I did my MBBS or MD training from Karachi, Pakistan, moved to America in 1998 and did my residency from Texas Tech University, and then did my fellowship from LSU Shreveport, and started my practice in Sugarland in 2013.
Well, you said Pakistan. I'm from India. Now we're going to have a huge night coming up. The World Series between India and Pakistan.
Apparently, it's a bigger thing than Valentine's Day.
Absolutely. Well, Valentine's Day is. You brought up the term Valentine's Day, and I want to, say, Happy Valentine's Day to each and every one of you who are listening. And if you would like to join in the conversation, the number to call here is 281-745-4161. You said rheumatology. That's kind of a fancy term. You want to explain to people what rheumatology means?
So basically, rheumatology is a study or it's a specialty that deals with joints, arthritis, and autoimmune diseases. When we say autoimmune diseases, some of our even arthritises are like the inflammatory arthritises, like rheumatoid arthritis, they're autoimmune disorders.
Yeah.
Other than arthritis, lupus is another pretty common autoimmune syndrome.
I see.
That also comes under rheumatology.
Okay, we'll come into what autoimmune disease means. Before we do that, tell us what are the most common problems you encounter in your practice?
Well, most commonly the patients that I see are arthritis patients.
Oh, okay. Are there different types of arthritis that you deal with?
So basically, there are a lot of kinds of arthritises which are broadly divided into two major kinds: inflammatory arthritis and non-inflammatory arthritis. When we talk about non-inflammatory arthritis, osteoarthritis is the first and most common arthritis in the world. When it comes to inflammatory arthritis, meaning the arthritis that can cause inflammation of the joints, rheumatoid arthritis tops the list.
Rheumatoid arthritis versus the osteoarthritis. Okay, that's fascinating. Ladies and gentlemen, you are listening to All India Radio Houston. If you have any questions about arthritis, give us a call. The number to call here is 281-745-4161, and you're listening to 1050 KCHN All India Radio Houston. Okay, let's begin with rheumatoid arthritis. What causes rheumatoid arthritis?
As I said earlier, rheumatoid arthritis is an autoimmune disease.
Yeah. What is an autoimmune disease?
Autoimmune, as the name implies, our own body starts producing molecules or cells in the body that attack our own body's immune system.
Yeah.
So in rheumatoid arthritis, same thing happens. We produce antibodies against our own joints, the cells of the joints.
So in other words, the body is producing something that's destroying the joints, and that leads to all this.
Destroying the joints, causing a lot of inflammation in the joints, releasing a lot of inflammatory markers.
Oh, I see. Okay, so at what age group do you see these rheumatoid arthritis patients?
So interestingly, there are two peaks of age, when it starts presenting in the body. The most commonly it starts in women around in their late 20s to 30s.
Oh, really?
Yeah. And there's another group of ladies or men in which it starts after menopause around in 60s, actually pretty late, in 60s to 70s when it starts, showing up.
What about the Desi population? Are they more prone for this rheumatoid arthritis?
No, actually, it's not more common in Desis. It's common all over the world equally.
I see.
But genetics definitely play an important role. So if it runs in your family, I mean, there's a chance that you can develop rheumatoid arthritis.
Okay. Does this affect any particular joints, like small joints or major joints?
Yeah. So basically, it starts in the small joints of the hands. And when I talk about small joints, I mean these metacarpophalangeal joints and the interphalangeal joints and the wrist. And later on, it can progress to larger joints, knees, ankles, and shoulders. Interestingly, the joints are always bilateral and symmetrical.
Oh, I see. So they occur on both sides.
Yeah, both the sides.
Oh, okay. Ladies and gentlemen, you are listening to All India Radio Houston. If you'd like to join in the conversation, the number to call here is 281-745-4161. And this is 1050 KCHN, Houston, Texas. This is All India Radio Houston. And my special guest is Dr. Saba Khan. And we are talking about arthritis. Okay, let's talk about when somebody walks into your office. I mean, I'm having joint pains from time to time. If somebody walks into your office, walk us through what are all the things that you do. One, to diagnose what kind of problem they have. What is the approach in terms of diagnosis and treatment?
Rheumatoid arthritis?
Yeah, let's start with rheumatoid arthritis.
Okay. So a typical rheumatoid arthritis patient would be, let's say, a 20 to 30-year-old or even 40-year-old female who's been having joint problems, joint pain, morning stiffness, swelling of the joints, fatigue, and maybe low-grade fevers for a few weeks to a few months. They might be losing weight, they'll feel feverish, they'll feel very tired. That's what basically prompts them to see a doctor.
Yeah.
From there, the way we diagnose rheumatoid arthritis, of course, it's like a detailed history taking and physical examination, and then there are labs and x-rays to confirm the diagnosis.
What kind of tests do you all do in the office?
So when we talk about lab testing, we check a CBC to see if they are anemic, because a disease called anemia of chronic disease can develop in people who have had long-standing rheumatoid arthritis. We check their inflammatory markers, SED rate and CRP, which can be elevated in rheumatoid arthritis, and specific rheumatoid arthritis antibodies called rheumatoid factor and CCP antibodies.
I see,
They are very specific in diagnosing rheumatoid arthritis.
You know, when we started off, you told us this is an autoimmune disease. Do you do any special tests to find out, what is causing this autoimmune disease, or to measure how far advanced the disease is?
Actually, no, I don't do any genetic testing, but definitely the prognosis depends a lot about on the level of the titer of the rheumatoid factor. The higher the rheumatoid factor, the chances of the disease being more advanced or progressive are higher.
Oh, that's interesting. So, what kind of do you like X-rays or MRIs?
Yes.
And how do they help?
Sure. Definitely MRIs and ultrasound can help in detecting rheumatoid arthritis early on when it's not even showing on the X-rays. But ideally what I do is I do screening X-rays at first to see if there are any changes pertinent to rheumatoid arthritis. And usually rheumatologists repeat X-rays from time to time, once at least in a year, to see if there is a disease progression.
Okay, since you mentioned you may see this in people who are 20, 30-year-old ladies, there's another condition which, as a cardiologist, I see, which is the lupus. You want to touch upon that, before we move on to treatment?
Talk about lupus?
Yeah, just how do you differentiate between lupus arthritis versus rheumatoid arthritis?
So, lupus is another autoimmune disease And this is very different than rheumatoid arthritis.
Yeah.
It's a multi-system disease. It can affect the body from head to toe. It can affect a lot of internal organs. It can cause kidney damage and all that. The arthritis that we see in lupus is called Jacquard's arthropathy. It does cause a lot of joint pain, inflammation, swelling, and deformities too. But it's different in rheumatoid arthritis in the way that it does not cause the same kind of bone damage or erosions that we see in rheumatoid arthritis.
Oh, that's interesting. Ladies and gentlemen, you're listening to All India Radio Houston. I am Dr. Nick Nickham. And if you'd like to join in the conversation, the number to call here is 281-745-4161. We are talking about rheumatoid arthritis and osteoarthritis. My special guest is Dr. Saba Khan. Okay, you want to give out your contact information and phone number so that if somebody wants to ask you a question or if they want to get some information about arthritis.
So we are located in Sugarland Methodist Hospital, Professional Building number 3. Our address is 16605 Southwest Freeway, Suite 530, Sugarland 77479. Our phone number is 832-999-4694. We also have a website called mydrkhan.com, and you can get a lot of information about us from that website. That website has our paperwork also. If you want to read about our practice reviews, there's another website called patientfusion.com, and if you put Saba Khan MD over there, you can not only read about our practice but also be able to make an appointment through the website.
Okay, that's fascinating. Ladies and gentlemen, you are listening to All India Radio Houston, 1050 KCHN. And if you'd like to join in the conversation, the number to call here is 281-745-4161. I am Dr. Nick Nickham, and my special guest is Dr. Saba Khan, and she is talking about arthritis. Okay, we were talking about rheumatoid arthritis. So what is the treatment and what is the prognosis?
So prognosis depends upon a lot of factors.
Yeah.
If you have a strong family history of rheumatoid arthritis, if you are non-functional to begin with, if you're obese, if you delay your treatment, and also if the rheumatoid factor is very high to begin with, the prognosis is pretty bad. Also, as I said, if you delay treatment, the prognosis is very bad. It's a slowly progressive disease. In some cases, it progresses very fast.
I see, yeah.
Now, we have wonderful treatment for rheumatoid arthritis, and there are even medications that literally stop the disease from progressing on a microscopic level.
I see. Well, what medicines do you routinely prescribe?
So again, there are a lot of medications when it comes to options in treating rheumatoid arthritis. We look at the patient, depending on how the disease presents in a patient. If it's mild to begin with, in some cases which is, then we start from milder medications. If it's a very aggressive disease to begin with, and the prognostic factors are bad, then we start with biologic therapy or more stronger therapy to begin with.
Yeah. So how do you measure whether the rheumatoid arthritis is progressing or regressing?
So there are blood tests to detect that. Number one, SAD rate and CRP, that starts to improve, as the disease gets better and better. And then there's another newer test called a Vectra Score, which I do at a baseline. And it basically, this test is an average of all the inflammatory markers that our body produces with rheumatoid arthritis. I do a baseline Vectra Score at the beginning of the disease, and then after treatment, 3 months later, I repeat it again, and it gives us an average, and it tells us if the disease is getting better.
Oh, okay. How do you find out, is there a cure for rheumatoid arthritis?
Unfortunately, there's no cure for rheumatoid arthritis. It's like diabetes. If you have it, you have it. And if you're on medications, chances are that you'll be on medications pretty much most of your life. Very few patients sometimes go into remission, but there's always a risk that it can come back if you stop the treatment.
I think it's the quality of life that really matters, and control of progression.
That's right. And since rheumatoid arthritis is also a multi-system disease, what research has shown that it can also lead to worse cardiovascular morbidity. It can lead to coronary artery disease, vasculitis. So the goal of the treatment is not just to control the inflammation and to improve the quality of the life of the patient, but also to improve longevity.
Ladies and gentlemen, we are talking about rheumatoid arthritis. We're going to take a little break, and when we come back, we're going to talk about the second segment, which is the osteoarthritis. We are talking to Dr. Saba Khan, and you're listening to All India Radio Houston.